Okay, ma'am, I'm ready.
Both are ready?
Yes, ma'am.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Okay. Hi, I'm Dr. Fyong. I'm one of the surgical doctors. Please, can I confirm your name and your relationship with the patient, please?
My name is Sarah, and I'm her mother.
Okay, nice to meet you, Sarah. I understand you have some concerns regarding your child, and I'm here to talk to you about everything, okay?
Yeah, I'm so worried about her. I was at work when I received a call that she was rushed to the hospital. What happened?
Okay, I understand your concerns, and unfortunately, your daughter was brought in by the school teacher to the emergency room, and she had pain in her tummy, and we accessed her and we did some initial tests that included a scan, similar to what we do for pregnant women. And we discovered that the appendix is inflamed, what we call appendicitis medically. But don't worry, I'm going to explain to you exactly so that you can get me, okay? I'm
Are
going
you
to
sure
draw.
that my daughter is having acute appendicitis?
Oh, that's a very good question also. Clinically, your child has the situation and a complaint is in keeping with an appendicitis, and in addition to the scans we did, but we can't be 100% sure until we go in and look. So let me explain to you what the appendix is and what your child may be having, okay? So try to imagine that this is your child's tummy. And then on the lower right part of your child's tummy, there is a small boil we find here, and that boil is called the appendix. So in some cases, especially in children at age, this small bowel can be inflamed, and when that happens, children of her age present with similar complaints. So when she came in initially, we accessed her, and then we gave her IV fluids, analgesics, and antibiotics, and the surgeon, Mr. Mann, is going to be here to operate on her. So do you understand what I try to explain to you?
Yeah, doctor, but is it dangerous?
Oh, that's a very good question also. Well, in some cases, the appendix can get to, if it's not attended to, in some cases it can get seriously infected, and the infection so can cause blockage in one of the tubes. And if this happens in a child like this, there could be a chance of having fertility problems later in life. So, but it is in some cases, not in every cases. So, but don't worry, the surgeon is going to operate on her, and she will be fine. She's in safe hands.
You should tell her about that because of less fat in children. If we do
Okay,
not
okay,
operate, the other answer.
okay. I was waiting for. Okay, okay. So then also, if we do not operate on her now, for children, they have less fats in their tummy, so they have an increased risk of this small boil opening up, what we call perforation, and it can be a lot more fatal than it is now. So it's much more reason why we need to operate on her now. Okay.
Okay, doctor, how big the scar would be and would the wound be disfiguring?
Okay, that's a good question also. So I'm again going to draw for you. Normally we usually just to create a small cut on the right lower part of the tummy. However, in some cases, there are times where we need to extend the cut in order to have good access to the organs and to the bowel in order to do the operation neatly. So sometimes she can have a more obvious scar.
Okay, so is there any other problem that could occur after this operation?
After the operation, like I said earlier, if the appendix is very infected, and the infection can cause blockage in one of her tubes. But don't worry, she just needs one functional tube to be able to conceive. And I also
Do,
told you that you have a question. I'm listening.
Yeah, but Mr. Ladd did operation on my husband and he died.
Oh, I'm so sorry. I'm so sorry to hear about that. Please accept my condolences. Can I get to know more about what happened to your husband?
He had colon cancer and he died few weeks after Mr. Ladd operated him.
Oh, I'm really sorry to hear this, but I want to explain to you that this is a different situation from that, and your it's very likely your dad would have died from the cancer itself and not from the surgery. And I want to also assure you that Mr. Man is one of the best surgeons we have in our facility here, and your child is in the best of hands. So don't worry, okay?
Can I see my daughter?
You will get to see her. You will get to see her. We are preparing her for surgery. Very soon the consultant will be here and we'll get to operate on her. Do you have any other questions or concern?
No, doctor, thank you.
Okay. If you don't have any question or any other concerns, please, do you mind signing so that we can go ahead with the surgery, please?
Okay, I'll sign that.
Doctor, how long
Thank
are
you.
you going to keep my child at hospital?
Okay, very good question. So after the surgery, we are going to examine your child and make sure your child is stable and has completely recovered from the surgery. After which we'll plan for a discharge and we'll communicate to the GP so that the GP will get to continue follow up with the care and your daughter will be fine. So don't worry. As soon as
Doctor,
she
I'm
recovers,
feeling so guilty. Is it my fault that my child has become ill?
I understand how you feel and I understand your concerns, but I also want to assure you that whether or not you were around, this situation might have still happened because it's very common in children their age. So please don't feel bad. Sorry,
When would
okay?
I be able to meet my daughter?
Okay, as soon as we are done with the surgery, I will let you get to see your daughter, okay?
Okay. All right. Good. Thank you.
Thank you very much.